Welcome to our channel. Today, we will be discussing a complex and relatively rare condition known as adult Still's disease. This is a form of inflammatory arthritis that primarily affects adults, although it is more commonly recognized in children, which can sometimes lead to confusion regarding its classification. Adult Still's disease, or ASH for short, is characterized by systemic symptoms such as fever, rash, and joint pain. But how does it manifest, and what do we need to know about this disorder? Let's dive deeper. Adult Still's disease is considered a type of systemic juvenile idiopathic arthritis, but it presents differently in adults. The exact cause of this condition remains unknown. However, it is thought to involve a combination of genetic and environmental factors that trigger an aberrant immune response. It is important to note that this is not an autoimmune disease in the traditional sense, which means that the body is not specifically attacking its own tissues in the same way as diseases like rheumatoid arthritis. The presentation of adult Still's disease typically begins with a high, spiking fever, which can be quite dramatic. This fever is often associated with a characteristic salmon-colored rash that may appear on the trunk and limbs. The rash can come and go, often appearing when the fever spikes. Alongside these systemic symptoms, affected individuals may experience joint pain and swelling. The arthritis in adult Still's disease is often unique. It can vary in its distribution, with some people experiencing polyarthritis, where multiple joints are involved, while others may have oligoarthritis, which affects fewer joints. Diagnosis of adult Still's disease is challenging, as there are no specific tests that can definitively confirm it. Doctors typically rely on a combination of clinical symptoms, laboratory tests, and the exclusion of other diseases. Blood tests may reveal anemia, elevated liver enzymes, and leukocytosis, which signifies inflammation in the body. One of the hallmark features during the diagnosis is the presence of a high ferritin level, which is an indicator of inflammation. However, these findings are not exclusively diagnostic for adult Still's disease. In terms of management, the treatment approach for adult Still's disease may include the use of non-steroidal anti-inflammatory drugs, or NSAIDs, to help alleviate the fever and joint pain. Corticosteroids may also be prescribed, particularly during severe exacerbations, as they can dramatically reduce inflammation and improve symptoms. In cases where the disease is persistent or does not respond adequately to conventional treatments, disease-modifying antirheumatic drugs, or DMARDs, such as methotrexate or biologic therapies like anakinra or tocilizumab may be considered. The choice of treatment often depends on the severity of the disease and the individual patient's response to various medications. Beyond pharmaceuticals, supportive care also plays a crucial role in management. Physical therapy can be beneficial to maintain joint function and flexibility, while occupational therapy helps in adapting daily activities to manage symptoms more effectively. Lifestyle modifications, such as a balanced diet and regular low-impact exercise, can also play a significant role in the overall well-being of individuals suffering from adult Still's disease. As we examine the long-term outlook, the progression of adult Still's disease varies widely. Some individuals may experience remissions, during which symptoms improve significantly or even disappear for extended periods. However, others may face chronic symptoms that impact their quality of life. It is crucial for patients to work closely with their healthcare teams to monitor their condition and adjust treatment plans as necessary. Living with adult Still's disease can be challenging, not just from a physical standpoint, but also emotionally. Establishing a strong support system, whether through family, friends, or support groups, can be instrumental in coping with the condition. Education about the disease, self-advocacy, and effective communication with healthcare providers are vital components of managing adult Still's disease successfully. Do not forget that early recognition and intervention are key to better outcomes. If you or someone you know is experiencing symptoms indicative of adult Still's disease, it is essential to seek medical advice for a thorough evaluation. Awareness is the first step towards effective management. Thank you for joining us today to learn about adult Still's disease. We hope this information helps you understand this complex condition better. If you found this video helpful, please share it with others and subscribe for more educational content on various health topics. Remember, your health journey is important, and staying informed is the best path forward.